maybe you can explain, to dentists who are watching, what is a CRM system? Why is it important to have something like this in your business so that you can actually drive more patients? Maybe you can explain in a way that dentists will actually understand, because I've really struggled to get this point across to them.
Your dental software is nothing more than a records management. It's think of it like a paper file on a cabinet, like the good old days. What you don't have is a list of who is interested in what we do but isn't ready to buy today. So if you had a room of 1,000 people and you said, who is looking to buy a car today? You might have one hand go up, probably none. But who's looking to buy a car in the next 30 days? You'll have more hands go up. How about the next 90 days? More hands will go up. How about the next 2 years? Probably a lot of hands will go up. And the same thing is true. You mentioned the concept of a sales cycle. This is the concept of a sales cycle. So if I have, I've been thinking about straightening my teeth, but I'm not really ready to do it today. The kids are in school for another year. I'm still paying for that, but I'm thinking about it. Well, do I now just forget about it because my dental software doesn't have a place for me to do anything with that? Like they're in hygiene, we talked about it, they're kind of interested, they want to know more, but then it dies. And how do you remember that? So there's dentists think about unscheduled treatment, like we planned it, the person wanted it, but then they didn't book it for some reason. What about the person is interested, but they don't want to book it, they're not ready to commit? What happens to them? What about people who click on a landing page and they want to download information about dental implants, but they're not ready to get one today? Maybe in a year's time, they get an inheritance and now they're ready. Well, what happens if you know that person is interested and you follow up with them with some frequency, even if it's just a few emails? When that person is ready, they're going to call you, not a year from now. Well, it's time for me to get this implant. Let's see who does implants. Let's look and see we'll search online and see about implants. You want them to think, okay, this is the person that talked to me about it first, and they're the one that keeps sending me good information about it. There has to be this process. So I'll give you a couple of examples of how we use this really well. And even an elite practice version, I'm sure you have many on your own. We had about 20,000 contacts in our CRM in a dental practice, of which about 12,000 were active patients, which I know sounds like a lot, and in a small town it is a lot, but we did a lot. So we never had an event. We never had any kind of marketing promotion where we didn't capture leads, which means email address, optimally mailing address. And then we would put them on our regular nurture campaign, which means a weekly email or a monthly mailing, like our newsletter. We just put them on our newsletter campaign, and they would just get our newsletter in the mail. And then they would start to develop a bit of a relationship with us before they ever did business with us. And then when the need came, well, who would they call? The people that had been following up with them, that have been treating them like family, that have been giving them good information for months and months, or just some random office in the, on Google, on a Google search, or Yellow Pages still exists up here. Do we just find a random office and we go there? So you're tipping the scale substantially in your favor for general patients, for patients of a specific procedure, which you can segregate. And this isn't difficult to do. By the way, we build this for every office that we work with. So they all get a CRM, they all get landing pages, they all get funnels that go with it, and they all get a simple form where they can add patients on the fly to different campaigns. And again, it's just like, if I want to do more Invisalign and I have a bunch of people who I know in my practice we've talked to about Invisalign, and I'm going to have an Invisalign day, well, gee, who should I invite, right? If I can pull up a list of people who are already interested, my close rate is going to be substantially better to have people attend that day and actually get the treatment done versus just randomly blasting from scratch. So there's a difference between a warm list and a just randomly cold list. Like if you go to just, the masses on the internet, it might cost you $250 to get a patient in the door. But if I have a list of people who I've already gotten interested in something and they've somehow, agreed to give us their information to get some information, or, in attending an event or something, those people, to get them in the door is substantially less. And they already are starting to build the know, like, and trust with you before they ever set foot in the office. So letting that go means that every time you talk to a patient, or a potential patient rather, you're starting from zero. versus picking up the conversation where you left off. That is how I would explain a CRM process to someone who doesn't have it. And I would highly recommend, thinking about that process. Now, it can be extremely expensive to set up, and it can be done extremely simply, or it can be like we include it with our program, because it really isn't that complicated, and the dental office doesn't need a massively complex system that then needs a lot of training to implement. It just needs to be effective and get the job done.